So during this ESMO meeting, we have presented the differences between both anti-EGFR agents currently available for the treatment of metastatic colorectal cancer patients. In summary, we have reviewed, first of all, the weight of evidence that we have using either cetuximab and panitumumab. In case of cetuximab, we have at least 4 randomized clinical trial phase 3 for supporting the use of cetuximab. In case of panitumumab, we have only phase 3 clinical trial. The clinical trial that we have in case of cetuximab, they support clearly the use of cetuximab, and it's with either combination of chemotherapy, FOLFOX or FOLFIRI. In case of panitumumab, we have only one clinical trial supporting the use of panitumumab in combination with FOLFOX. However, the use of cetuximab is completely supported using either FOLFOX or FOLFIRI. So if we think about the use of other options in combinations with chemotherapy, like bevacizumab, we have, in case of cetuximab, 2 head-to-head clinical trials supporting the use of cetuximab, FIRE3 clinical trial, and as well CLGB 8045 with a clear conclusion supporting the use of cetuximab instead of bevacizumab. In the other side, inside of panitumumab, we have only one clinical trial, a phase 2 clinical trial, the PEAK clinical trial, that the main conclusion, no difference between panitumumab and bevacizumab. So, moreover, when we talk about the mechanism of actions, we have currently 2 different immunoglobulin antibodies. In case of cetuximab, we have an IgG1 antibody. In case of panitumumab, we have an IgG2. And it's not a trivial difference because all IgG1 antibody, they can induce an ADCC-mediated mechanism. So it means that we can promote an immunogenic cell death and it's an add value of using cetuximab for these cases. So what about the side events that we have in both anti-EGFR agents? So we can see from an analysis of all the phase 2 and phase 3 clinical trials that we have more skin toxicity and as well more frequency of hypomagnesemia in case of using panitumumab compared to cetuximab. So that's clear that probably we can think that initially we have 2 potential quite similar anti-EGFR agents, but more in detail, we can see very significant difference. That it means that we have 2 very different approaches targeting EGFR in metastatic colorectal cancer patients.